It's our program. It's your program, Weekend Deal. We are here every weekend, Saturdays and a Sunday. Yesterday, our focus was on the power sector. And today, another giant look, another big leap. Very interesting one, and in our best healthy interest as Nigerians. Of course, you got the catchphrase, healthy interest. We're talking health today on Weekend Deal. It's great to have your company. And don't you forget that our program is interactive. We want to hear from you, just like we did yesterday, just like we always do. Get your messages and experiences in. And that's why we've invited and have the pleasure to welcome Dr. Henry Ewunono, the spokesperson for Health Sector Reforms Coalition. Who would have thought? This is the first I'm hearing about Health Sector Reforms Coalition.
Oh my God, this is a coalition. Good morning, Nigerians. Thank you for having me. This is a coalition of over 60 CSOs that fought for the actualization of the National Health Act.
Okay, great.
We have been there.
Great. We'll talk more. Now, let's see what Francis is going to open up the conversation with. Francis, take it away.
Nigeria has a multifaceted healthcare system with public and private health providers, with both modern and traditional healthcare systems. Moreover, healthcare provision is the concurrent responsibility of the three tiers of government. What would be your assessment of the health sector in 2022? 23 years after the launch of National Health Insurance Scheme by the federal government, available statistics indicate that less than 10% of Nigerian population have registered for the scheme.
The uptake of National Health Insurance Scheme is still very, very low. And in terms of healthcare, the most important thing is how do you finance it. Health is not free anywhere in the world, I keep telling people. Even if you're taking it free, somebody is paying for it. So there must be a mechanism to pay for it. And Nigeria has one of the highest per capita expenditure in health in the world. Almost 70% of our pocket expenditure for health comes from our pockets. Whereas in other climes is a pooled resource, healthcare insurance. So the National Healthcare Insurance, one of the key things that has happened too is that there was a proper re-engineering of the National Health Scheme. It's now called the National Health Authority. And then what this means, if we were able to enable all the policies and everything in the Act, healthcare insurance will now be compulsory for every Nigerian. And that will mean we'll be able to pool resources. And let me give you a snippet of that. In Abuja here, the health insurance will amaze you is only 13,500 naira per person. And this means once you pay that premium, you are entitled to almost free healthcare all through the year, up to the level of appendectomy and even cesarean section for a woman who can have a baby through the normal vagina. But how many people are enrolled on it? Just about 150,000 in Abuja.
Globally, it is recognized that the primary health centers provide an efficient and equitable means of health care delivery due to its proximity to the people. Thus, the Nigerian government prioritized revitalization of primary health centers spread across the 774 local governments as a necessary step towards universal health coverage in the country.
The primary health care were not in an optimal level nationally, but I do say in some states they have done quite a lot. And those states that have done quite a lot, I can tell you that FCT has done a lot, revamping some primary health care centers, working with some development experts to redesign and then also make sure that they are working optimally. Other states like Lagos and Kaduna states have done quite a lot in terms of revamping their primary health care. But generally, nationally, primary health care is still not at its best optimal running, should I say, capacity. And that's why you see people go to a place like National Hospital, they complain that they went there for hours, that they didn't get services. The reason is that there's no way they can work optimally, because the patients going to the National Hospital have no business there, most of them. They were supposed to have been taken care of at the primary and at most at the secondary care level.
Beside poor budgetary allocation to the health sector, 567 billion naira is lost to medical tourism yearly in Nigeria, an amount that could have been invested in the development of the country's healthcare system and the country as a whole.
There has been a lot of our healthcare professionals living in the country. In the past 1 year, almost 4,600 have left to the UK alone. In fact, it is said that only about 24,000 registered Nigerian doctors are in the country right now, which is less than 10% of what WHO has put in as the minimum any country should have in terms of doctor per capita. And Nigeria has one of the best trained doctors. I am one. In my class of 80, 75% of my colleagues are outside this country. That I'm here, I chose to stay because I feel this is where the work is. And thank God I have been able to do a lot. I was part of conceptualizing the midwifery service scheme that brought maternal mortality down by 40%. So it's not everybody that will be that patriotic. But all the same, if we make the environment conducive and pay appropriate salaries, I don't think anybody will want to leave the country. Nigeria still remains one of the best countries in the world, I can tell you, regardless of whatever challenges that we're having. My expectation is that one area I will emphasize government should please pay serious attention is what I call strategic purchases. And the most strategic investments the Nigerian government will make is to invest in family planning. And I'll tell you why. For each dollar that is invested in family planning services, the return on investment is about $120.
Today on Weekend Deal, our focus will be on expectations for the health sector in 2023.
Francis spent some time talking and learning with the Senior Special Assistant to the Minister of Health on health services. And I was just talking, Dr. Henry, we don't know, the last thing he said $1 invested in family planning. Yes. The return on investment is $120. Are we now going to be doing health services in dollars? Tell us what that means.
Yes, thank you once again for inviting me. What that means is that health, first of all, is not just a mere expenditure. Whatever amount of money you spend towards healthcare of the people is an investment. That means you are expecting to reap dividends. How is this dividend in family planning subsector? How does it come about? The health of the woman, the health of the family. The family is able to train, bring up, nurture the few they have, so that they will now be able to be productive in other sectors.
He said something again about over 4,000 doctors seeking greener pastures in the last 1 year. Are we saying that the health sector in Nigeria is not productive or exciting enough, or they don't have enough patients? Do they need more work?
The truth is that nobody knows the actual number. All these are estimates.
Estimates, okay.
You see, because how is it monitored? People traveling to other places, greener pastures, seek what they call letter of good standing with the Medical and Dental Council of Nigeria. So in the process, they're able to track and say, oh, in 2022, these are the number of doctors that have applied to us. But let me tell you the truth. Some don't even bother.
But can I tell you something, Dr.
Yes.
Henry? The number of those who are leaving
Yes.
is not really what astounded many of us. What is more astounding, whether they are 4,000, 3,000, is that the number left is less than 30,000 for the entire Nigeria.
You see, we have been calling for this, call it a conference, call it a dialogue, call it what? The health human workforce, health manpower. Let there be, call all the stakeholders together, put the cards on the table, ask questions, provide answers. How many are we really? The doctors, we know today there are doctors that own big firms outside the health sector. Are they part of this number we are talking about? They are part of this number. Doctors in politics, are they part of this number? They are. Doctors in business, doctors in administration. Today there are up to 5 medical doctors who are permanent secretaries in Nigeria. So these are among the number you say, are they available to heal the sick in Nigeria? No. So that's what I'm saying. Nobody has effectively determined the effective number of serving medical doctors and other healthcare professionals.
But the area
in
we
our
are playing
country.
with, the area, the number that
Yes.
we're playing around with
Yes.
is shocking for many
It is
Nigerians.
shocking, but you see, again, it's just why we use the term tip of the iceberg, is that we are just looking at the gross figure. We have not even come to look at even the distribution.
The actuality.
Because in the FCT here, the city center, you may say, oh, 1 doctor to 3,000 to 5,000 patients. In Abuja, what is the ratio? Are people living in Abuja not citizens of Nigeria? Don't they deserve to be served, by qualified medical doctors? Don't they deserve the same quality of healthcare?
Well, sure they do. But let Magdalene tell us what she found. Magdalene had the opportunity to talk with the chairman of the Nigerian Medical Association in Abuja. Magdalene, take it from here. The building block to every level of productivity is stable health, and systems to support this are well represented in many nations of the world. In Nigeria, it seems as though the reverse is the case, as statistics show that 35,000 health practitioners have left Nigeria for other countries in the last 3 years, and the brain drain in the health sector does not seem to be slowing down anytime soon.
Over the years, there has been brain drain from the country before independence, after independence, in the 80s, 90s. However, something significant has happened in the last couple of years. The COVID pandemic was an eye-opener to the whole world. In fact, the westernized, developed countries suddenly realized that they are very far away from doctor-patient relationships. Yes, because of the overwhelming demand of COVID pandemic on the health systems across the world, it became very obvious that not even America has enough doctors to look after their patients. And so it applies to the rest of the world. Just before the COVID pandemic, 2009, there has been a gradual increase in emigration of doctors and nurses. Although it dropped a little bit during the 2 years of COVID lockdown, but that drop was simply because of international lockdown. From what we witnessed in 2022, there has been a very sharp increase in the immigration of doctors, nurses, and other healthcare providers out of this country, Nigeria.
In order to revamp the health sector in Nigeria, experts state that there is need to improve the diagnostic facilities, remunerations, working conditions for health practitioners, to mention but a few. As compared to other countries, Nigeria is way behind. Meanwhile, health indicators may continue to decline in the absence of aggressive intervention.
In the medical registry of the Nigerian Medical and Dental Council, we have on paper we have about 50,000 doctors that are practicing, that are registered to practice. However, on ground, we know that we're not up to 30,000 to look after an expanding population of more than 200 million people. The environment where we're operating, all of us, not only doctors, it is not a very conducive environment. It is a hostile environment. We are grappling with several economic issues. We are grappling with economy that is just struggling to sustain life within it. We are grappling with insecurity in the country. We are grappling in our work environment. You need to visit some hospitals and see that the facilities aren't just there.
To this end, recently, the 2023 budget shows a significant increase from the 826.9 billion naira allocated to the health sector in 2022 and the 547 billion naira allocated to the health sector in 2021. According to research, there is a 25.54% increase this year, 2023. This may put a smile on the faces of many practitioners if the fund is properly utilized.
The current budget of 1 trillion naira plus for the health system in the country is too small, even though it is the highest in recent times. But it is too small. It is too small because it still falls far short of the African Union declaration of 15% of the annual budget. The current one is just about 5.75%. Therefore, there is a continued underfunding of the health sector.
To reverse the brain drain syndrome in Nigeria, many urge government to create a conducive environment that will ensure employment opportunities and also provide financial incentives, amongst other things, for medical professionals in Nigeria. If we consistently say that health indeed is wealth, and that without sustained health we can do little or nothing that can be productive, then it goes without saying that we must take our health very seriously, and we also hope that those who are in charge of health management will do so as well. Tell us about the Abuja Declaration in 2001.
On April 23, 2001, next to you here at the Abuja International Conference Center, African heads of state and government came and said, having considered the enormity of the health burden, disease burden in this continent, every country should go back and devote not less than 15% of the annual budget to health. That was at the time malaria, HIV, tuberculosis, and so on were ravaging the continent. Ebola has not come that time. COVID has not come. Lassa fever is resurging. The non-communicable diseases are now resurging. You now hear that young people are slumping and dying. Even in churches, pastors are slumping and dying. So if there is even a time, if in 2001, with the lesser disease burden status of Africa, they say 15%, let's start with that. It means that in today's world, 20% may not even be enough. But that is not the problem. You know that, for instance, the Federal Ministry of Health is still returning unspent funds at the end of the year.
How is that possible?
Is that not a paradox? That is what we are talking about. That we need to, whoever will come, 2023 is a special year. This election this year is most crucial because if Nigeria doesn't get it right, that's when people are talking about a failing nation, failed nation, sitting on the precipice, will unfold before our very eyes. We need to get it right. We need people that will sit down. We have looked at all these contestants. Their manifesto, of course, if you go and check, you see that you may even see contents of manifestos of 1979 brought forward. Copy, paste.
Dr. Henry, were you there?
You have not seen, I said one may even see. So the thing is that you have not seen people who sat down, interrogated the issues, went and investigated and saw that, oh, yes, on paper, 30,000 primary healthcare centers in Nigeria, but how many are functional? What do we mean by functionality? The structure, infrastructure, the equipment, personnel, running costs. Again, as regards healthcare financing, this envelope system is not helping us. Unfortunately, President Buhari promised to institute what they call zero-based budgeting. Starting from the foundation. You say, for instance, to identify an issue. It has been identified that 3 elements mainly: cancers, kidney failure, sometimes stroke, arthritis, and other things we group as non-communicable diseases, complications of them. These are the things that make Nigerians spend over $2 billion annually.
Good one. Just hold that thought. Let's now go talk about insurance. Because we know that no matter how wealthy you are, paying out-of-pocket cost for Medicare is hardly ever easy. Just a year can systematically empty accounts of a supposed wealthy family. Uma went out to the streets and spoke to people about how aware they are about NHIA, which initially was NHIS. Let's see what she found.
The National Health Insurance Authority, NHIA, formerly known as the National Health Insurance Scheme, NHIS, is a corporate body established under the NHIA Act 2022 by the federal government of Nigeria to improve access to quality and affordable healthcare for all Nigerians.
I've heard of NHIS, yes. I'm really not a member of NHIS, but I know it's very, very easy to register. You go into your hospital or any hospital that has NHIS registered with them and register. It's that easy. I don't think it's any rocket science.
I'm aware of what NHIS is, and I think I used to be a beneficiary when I was a core member.
I've heard about it. It's over 10 years now since it came into being. I know that companies, corporations, institutions, even those up to 10 staff are requested to enroll.
The Nigerian government took a definite step to establish the National Health Insurance Scheme under Act 35 in 1999 as a social tool towards attaining equity in health service delivery. In 2005, it became fully operational with a presidential mandate to achieve universal coverage as a tripartite public-private arrangement. Amongst the 3 main stakeholders are the NHIS, the HMO, which is the Health Maintenance Organization, and the employees.
From the onset, there were a number of problems in terms of registration, because Nigerians thought it was one of those fraudulent schemes. But over the course of time, it has been established that it is functioning.
As a beneficiary, I have a personal challenge, and because once you are federal staff, you are bound to be transferred. So I was transferred from my office. I was in New York by then, 2016. So I was transferred to Abuja, the headquarters. Since then, for me to transfer my health facility was a problem. It's only this last October I was able to succeed.
People who are registered with the NHIS at the National Hospital have a lot of challenges getting their code. And I think there should be a relationship with the management of national hospitals and even the desk of the NHIS at the National Hospital so that things will be done smoothly.
The program covers employees in the formal sector, public sector, and organized private sectors. It is meant to be for every organization with 10 or more employees and individual voluntary contributions. But how many organizations are adhering to this rule?
Sometimes, personally, I don't so much believe on drugs. So, if you don't go, your money is there. That's a challenge. So, there are some people who will not be going to the hospital and they must deduct your money.
Some people find it very difficult to afford their medical bills. But I believe if they were being covered by insurance, I think that would have made life a lot more easier.
To the best of my knowledge, I think it covers to a certain point childbirth, if you're registered in the hospital for antenatal, I think they have their own separate registration for antenatal and childbirth and payment.
With this, Nigerians are expected to have very reliable access to excellent healthcare services, irrespective of their financial status. at the time of receiving these services.
Health insurance. From what we hear, what we read from friends and family we have in different parts of the world, it does seem to be working and having a great impact on the citizens. Back home here, let Dr. Henry tell us what is happening. Health insurance, is it existing? Is it working? Who is benefiting?
It's existing. Some people have benefited. They talk about health insurance started in about the 60s, shortly after independence. That's when it started. It was until 1999 that General Abdul Salam actually signed that decree, the health insurance scheme decree, before leaving. But it was made an act of the parliament about 2003, but it was launched by President Obasanjo in 2005. From 2005 to 2023, the National Health Insurance Authority, formerly insurance scheme, says we have about 7% coverage.
7%
you assess from 2005 to 2023 for a commodity such as health insurance. What does this health insurance mean? A strategic saving, a strategic contraptment strategy for the rainy day of illness, so that you can have access, especially financial access to health without suffering catastrophic experience, financial hardship. That is the only road to have everybody covered under this umbrella of good health called universal health coverage, and that's what we are preaching, health for all.
Is it workable in African countries?
Different. Yes, other African countries are doing it. Ghana has gone beyond 80-something%. Rwanda is working in South Africa. Look, some smaller African countries, they have gone past us. Unfortunately, our country thinks that every other part of the world is just there.
But can I ask you something, Dr. Ewunono?
For them.
Are you optimistic? Because the challenges seem to be getting more humongous, getting larger. And it does seem like we've learned with past experiences that if you don't nip something in the bud, problems don't disappear. They need to be solved. Are you optimistic that we can get universal coverage for all rights at some point?
It only takes one man, the President of the Federal Republic of Nigeria.
Okay, let's leave it at that for now. We'll take a break. You're watching Weekend Deal. We want your messages to be coming in so we can share them with Dr. Ewunono. He's here. He's the spokesperson for the Health Sector Reforms Coalition. And for us to have a coalition such as this, it goes without saying that people have thought it wise that reforms are necessary and needed in the health sector. Let's go on this break together. Weekend Deal is great to have your company. Without you, really, there's no us, and that's why it's pertinent to take this message from Onwuzurike Godwin Yakubu. He says the federal government should subsidize health insurance for the majority of Nigerians. Say thank you and God bless you. Dr. Ewunono, health insurance being subsidized, throw more light on that.
Yeah, the federal government is already doing that. The insurance scheme started with the formal sector in Nigeria, mostly civil servants in the federal civil service, or federal public service. And what we pay, I am an insured life with the National Health Insurance Scheme. I have come to take insurance subscription with you. So you now send me, go to this hospital. I fall sick, I'm treated in that hospital. That hospital gets back to that organization and said, this is how, and present the bill. So there's no middleman. From the times of colonial administration, slave trade, all that, produce trade, wherever you have middlemen,
there'll be challenges.
Yes, the consumer is
turn themselves into demigods.
Federal government, what we pay is not up to 10% of the bill. Government brings the rest. However, some of the constraints we have with the Nigerian Health Insurance Program, organized labor said no at the beginning. Because of what? Lack of trust. It is expected, this trust we are talking about, that nobody will put his dirty fingers into that pooled funds and steal from there. So that you can grow this fund, since everybody will not fall sick the same day. So that on that person's rainy day, there will be something. There is always something for everybody, since everybody will not fall sick the same day. That's what it means. Somebody was telling me the other day that equity, is it in health? Is it everywhere? It's not dashed. It's not dashed. You fight for it. So this is an area Nigerians, especially retired people, with the amendment, they say, oh, amendments of the law now, they say retired people are now going to be covered. I think there's something like that. You know that you contribute, let's say if you're one of those who don't fall sick often, on your retirement day, you stop being covered. That is terrible. It is towards old age that people not fall sick.
That's when you really need their assistance.
We need people to sit down to say, what are the challenges with our own? Why is our own health insurance not working? Well, how come people don't believe our own? Again, this thing of is in the package, it's not in the package. My own form of ailment may not be covered under the scheme. So why should I continue to contribute? People are not the same.
What people even talk about is that if the elites, if it was everybody putting eye on this thing and knowing they can benefit, then perhaps we'll take it more seriously, because we know that there are a group of people who can afford Medicare outside our shores.
Yes.
And people wonder, how come when we say the health sector needs reforms, oughtn't we to come together, all working hands, all committed minds, all resilient people working to ensure it works here? Can you compare the ease of just working from your house to go do a minor or major surgery than to be looking for a ticket, carrying your box and boarding this thing to go to a land that is not really yours? But let Ayuba tell us what he found. We'll be back, Dr. Henry. Ayuba, tell us more.
Medical tourism refers to people traveling abroad to obtain medical treatment. This occurrence happens in two ways. Firstly, is people going from less developed countries to major medical centers in higher developed countries. Secondly, is people from developed countries traveling to other countries for lower priced or alternative treatments. In the case of Nigeria, the former is more applicable. And the question is, why?
Basically, for me, I would say it's ignorance and ego. Ignorance in the sense that people may not know whether the facilities they are looking for are in the country or they are not. But the second aspect is ego. If I have money, I have to show that, yes, this is what I can do. Because even if the treatment I'm going to get is at the doorstep of my house or my office, but because I have the money and I want to show that I did this outside the country. I give you an example. One of the minister aide some few years ago came for treatment in my place when I was working in Maitama Hospital. So he boastfully said he had social treatment in Dubai when they went with the minister's children. And these are the treatment we can do successfully because we have good facilities, we have experts that can carry out. But because they travel out of the country, he was boastfully saying he had that treatment abroad. And I give you another example. People rush to have their babies outside the country because, number one, some countries will say once you have a baby there, automatically the child becomes a citizen. Secondly, I'm going to boast to my editor, when I had my child abroad, it's like ego, like I said earlier.
Despite the efforts by the federal government to improve upon quality of healthcare in Nigeria, many still travel abroad for treatment and checkups, which has a negative impact on our economy. But what many Nigerians don't know is that a lot of these medical services are actually available and affordable locally.
Many Nigerians, when they come for summer holidays, they keep their dental treatment to come and access it in Nigeria. Because even though there is this national insurance in the local countries, but in dental, their own is a bit different. You may key into the insurance, but you have to pay extra. And I give you an example for, we call it orthodontics treatment. If you are going to give a crown in Nigeria, it is from maybe 30,000 to about 85,000 Nigerian money. But if you are going to access that treatment abroad, you are going to pay through your nose. Because I may not say it's 2 times, 3 times, it's more than that. So a lot of them will wait till they have opportunity to travel. And it's even easier and better for them to even pay their airfare to Nigeria, come do the treatment and go back. With the airfare and the treatment they are going to get in Nigeria, you can't compare it.
What logical steps could be taken to discourage international and intranational medical tourism?
If policymakers will be sincere to themselves, develop every local government, every state with good hospital facilities. For example, in the 90s, Abuja government developed National Hospital in Abuja. And it's one of the best facilities in health that you can think of. If subsequent administrators came and do the same and say, okay, we may not do it in states, but let's do it in 6 geopolitical zones. If I'm coming from Maiduguri and I have a similar hospital of National Hospital in Gombe or Bauchi, I may not necessarily come to Abuja, and I may not think about going abroad.
Here is hoping that the future ushers in better policies, schemes, and programs for Nigerian citizens to have better access to quality healthcare.
Aiba was talking with the dentist over there about medical tourism, and we got to hear that. I know that dental care abroad is quite steep, that some Nigerians come back home to access their dental care, but dental care is just one aspect of Medicare. We talk about surgeries, some babies are born over there. A lot is happening with medical tourism. Tell us, and we've heard that Nigeria is giving out millions of dollars to foreign countries, money that have put to use here. We also learn that people are going outside to get what we have in here. Do we really have the necessary equipment and treatment here?
The truth is no. We don't. Most of our hospitals are substandard. The National Health Act 2014 in Part 2 said there should be, first of all, classification of hospitals and technologies. Thereafter, then certificates of standard should be awarded so that you can say this is an orthopedic hospital, they can do ABC procedures. Since 2014, that has not been done. Nigerians should ask the Federal Ministry of Health why our hospitals have not been classified according to that act, and why there are no certificates of standard, so that you enter a hospital, you see their certificate of standard.
Just like the hospitality industry.
Yes, just like the hospitality industry. I say, this is what we can do. The Section 46 of the National Health Act has said no public official should go out for medical treatment at the expense of the people, of the public purse. I don't know whether they are going out with their private money or with government money. But again, why do you want, are you cooking food for people you don't want to taste from there? Our public officials, how many of them, how many local government councillors patronize the primary health care center in their ward? How many local government chairmen patronize the general hospital in their ward? What of state governors? We heard of a state governor that sends his children from somewhere in the south to Abuja to come and treat malaria and Qatar.
Let's now go to Sokoto, where they focused on primary health care. Let's see what they have to share with us.
Rural communities struggle to access most essential human needs, such as health services. For this reason, primary health care facilities are established, especially in rural areas. In Sokoto State, there are over 800 primary health care centers. One of them is the Balkore Village Primary Health Care, where Abubakar is among the clients. The hospital has been in operation in Balkore Village for some decades. However, Abubakar acknowledge a shift in service delivery now. Some health services programs initiated have improved affordability of drugs and other medical consumables in primary health care centers of Sokoto State.
Based on the program we are running here, Basic Healthcare Provision Fund, this facility get a lot of development in terms of facility and supply of essential drugs.
We have this Basic Healthcare Provisional Fund drugs from Sokema. We call them enrollees, that we register the vulnerable group, like the children under 5, the pregnant mothers, and then the elderly. We enroll them, we register them. And then based on that, we are being given this capitation to procure drugs, and then also some mild maintenance out of the funds, where we issue free drugs to all the enrollees that we are registered. And then for drug revolving fund also, we have a supply of drugs, where we write request, and then we are being given the drugs based on request, and then we sell in subsidized price.
Ana ba mu tas injini kyauta kingi a ce mu yi in muna zarafi mu yi in ba mu da mu ta gida mu shiryo.
To gaskiya yanzu dai da ni taho na zaka da 500. To maganin da an ka rubuta mini sun ka ce abin da ya kama 700, amma wanga guda biyu shi an ka an shi naira 3,000 din ga sun ka ce kyauta sun ka bani.
Even among urban communities, primary healthcare facilities now provide inpatient services that were before now only serve as secondary and tertiary health facilities.
Maimakon a rubuta maka magani ka tashi ka je Gwadabawa ko ka je Kware wurin neman maganin, sai ya zan gashi nan cikin asibiti, sannan duk inda ka je kusan maganin sai ya zan December ground, irin wanda duk ake samu a wannan asibitin shine ake samu a kowace asibiti.
In healthcare delivery, adequate qualified personnel are very critical.
We are running 24-hour services. So while some of the staff are on duty, some of them will go for off. So this is where we are still having challenges, more especially in the ward. The staff managing the ward, you will find out that we will admit more than 20-30 patients.
We have a gap in the manpower, and he quickly approved the recruitment of over 1,200 staff, and the recruitment is ongoing, which the first batch has now been recruited, and they are going into the service.
Attaining 1 doctor to 600 patient standard may not be realistic in a developing nations like ours, but with more health institutions established for training of personnel, health sector work post in the state is expected to improve going forward.
Primary health care from Sokoto. Interesting. They have drugs. District head said the drugs are all the same. The lady who spoke with us said she would like more staff. But the good news is that drugs are being subsidized. Dr. Henry.
I take that report with a pinch of salt. Forgive me, but I challenge anybody to just do random checks. Maybe not within AMAC, for those of us that live in Abuja. Nigerians, wherever you are living, start with a health center in your village, in your wards.
But tell us, as we wrap up, Dr. Henry Abwinono, spokesperson, Health Sector Reforms Coalition, how aggressive has this Reforms Coalition been? What have you achieved? We're wrapping up.
In 2003, President Obasanjo brought a man from the WHO, Professor Itai Lambo, to say, come and help us. A seasoned world-class health economist. He came and said, look, we need to reform the system. We need change agents. So Health Sector Reform Coalition began through this change agent program. And they said we need an overarching legislation that the countries that have done well have this national law guiding health. So one of the success stories that the Health Sector Reform Coalition championed is the National Health Act. They are presently conscientizing Nigerians to shine their eyes well, to interrogate the health component of the manifestos of political parties and their candidates. Because health is everything. Remember what happened in 2020? Just because of one virus, the whole world was switched off. Indeed. So, we need these political leaders who first have empathy, compassion. Secondly, they have knowledge, broad-based knowledge, and willing to work with people. And Health Sector Reform Coalition is willing. Whoever wins, we don't have preferred candidates. Whoever wins, we will work, together with that candidate, with the party, to interrogate our problems. We have provided some solutions already. We are ready to work with these people.
Okay, thank you. Thank you. We have to leave it there. We must thank you. Most immensely, Dr. Henry Awinono, spokesperson, Health Sector Reforms Coalition. We've begun our reformation right here with him. We hope we continue to take the message out there. Thank you for coming on Weekend Deal.
It's my pleasure. Health is wealth.
Indeed.
Health is security. Health is development. Health is politics.
Thank you.
WHO says until you get your politics right, you can't get your health right.
Thank you. We'll go on a break on Weekend Deal. Don't go away. EJ is telling us about Ijoma is telling us about the importance of early testing, which of course signifies early detection if there's something that should be addressed. Let's talk with Mr. Imal Silva. He's an artist and he uses his artwork and entrepreneurial spirit to provide a platform for HIV and AIDS. You're an activist through art?
Let me call myself a change agent.
Oh, great.
Maybe that's milder, but yes, definitely we are advocates. How can we use the arts to promote health issues? How can we get people engaged on health issues and get us interacting with every stakeholder in the community and with the government as well?
Are you at the community level? Are you going state, nationwide?
Well, it's been a personal effort at the beginning, but then definitely by the time you do it for long enough and you actually make an impact, you find out that other people begin to also want to be part of that journey. So we have more artists coming on board, and as well as institutions that want to be part of it.
Sponsors?
Yes, we have had certain funding for some of our projects, and we believe that more will come as we do better and more more extensive work.
What impact have you made thus far with this idea and plan?
Well, here right now we are talking about healthcare as an artist and how to promote healthcare. Well, one of the first things we did was to educate people about the history of medical practice in Nigeria. We were able to set up a museum of medical history. I was part of the team. It's situated in the University College Hospital in Ibadan. And from there, we also took topics like HIV/AIDS, things like intimate part of violence, sexual abuse, and how it affects people's health, mental health. So one by one, there's so many issues to handle, and then you pick them one by one.
Are people understanding? Are you able to, touch them?
Definitely, because the arts have a way of touching us deep within. And then when you come to people from a less official, less formal way, and you're able to connect with their culture, with their roots, with their history, with their personalities, they begin to open up the more, and then we can actually get them to, take a lead in such things.
So the lead now involves them going out to the community?
Exactly. So what we want to achieve is we do that initial bit, and then we want them to give, to be the ones to actually lead the change in their locations.
How would that work?
What we have advocated is basically for people to come up with initiatives in their own localities. So let us assume you're in a particular place and you have a particular issue. Maybe one of the problems you have is because of the lack of pipe-borne water, and then you're having waterborne diseases. So we initially educate you using the arts, and probably visual arts or performing arts, or what it could be, a theater performance, it could be a visual art exhibition, whatever it is. And then you begin to realize that, yes, there are problems, but there are also solutions. And there's a path to the solutions. And the path to the solutions may involve going to meet the stakeholders, the government, the people that are actually specialists in these areas, and then find out what other specialties you can bring to provide solutions within that locality.
Your final words to those people who are ailing and they think all hope is lost. Sometimes some people go through ailments that seem to have no physical solution, in that they know that death may come earlier than they expected. What is your word for them so that they are hopeful and they are optimistic in spite of what they are going through?
I will use 1 minute to tell a little story about an experience I had. I had a particular condition, and I started the treatment here, and I felt I couldn't get the treatment. This was several years ago, and I traveled abroad, spent all the money that I could, and I mean, including going to surgeons trained by the Royal College. But I couldn't find the solution. I gave up and I came back. And then the solution came through a Nigerian doctor, but who happened to be in England at that time, and who was a specialist that were just 1 or 2 in the whole world, or maybe more than that now, but there were very few. So he happened to be in the country, and two sessions with him, and that was it. It was
You were
solved.
okay.
So what we were going around all over to look for was right here.
Right at your
So
doorstep.
if we had actually provided the right environment for him, he would have been here. If he had trained abroad, and he actually brought a few equipment, they're not even very sophisticated things. And they was able to achieve what he wanted to do.
Advise us now with this story. What are we to learn from what you're telling us now?
In terms of human capacity, in terms of expertise, there's nothing that the Nigerian doctors cannot do, given the right the skills and the knowledge. The question will now be infrastructure. The question will now be equipment. The question will now be the enabling environment. That will make the difference.
And then when all committed hands are on deck, working resiliently, I think we will get there.
Definitely.
It is possible. Mr. Imal Silva, thank you very much. It would be good to see your artwork sometime, especially as it pertains to health, HIV, prevention from mother to child.
Surely.
I wish you well in all your endeavors.
Thank you very much, man.
You're watching Weekend Deal. Yesterday, our focus was on the power sector, and we did tell you about industrial enterprise parks approved by President Muhammadu Buhari, 7 in all, and Edo State has taken off. They couldn't get that feature for us yesterday, but we have it today. Let's see what it's going to tell us.
This business is a daily business. A daily, if we know, no shop. The light is not good, or it's not helping us, because this place they are sharing the lights, and we are paying huge amount of money for per fridge. Like each deep freezer here now we are paying 1,000 naira, 1,500 for one deep freezer.
Everyone knows that light supply in our nation here is very poor, and it affects us a lot.
These are 2 small and medium-scale entrepreneurs who need electricity for their businesses to flourish, lamenting the state of electricity supply in Benin City. However, with the coming on board of the independent power supply by the Edo State government in conjunction with some private investors in 2022, the situation has changed, with a growing list of private companies in Edo State connecting to the 95 megawatts Osiomo power plant in Edo State, providing a leadway for the businesses to maintain stable electricity supply to boost their businesses, increase productivity, and contribute to the state's gross domestic product.
This is one of the advantages of this present administration of Governor Godwin Obaseki. We are glad that at least we can boast of 24 hours lights in this very place.
In terms of availability, we always have light. I think I give that to the government.
The electricity situation here is a lovely one and a palatable one, because compared to outside, it's much more better and more preferable for any business person compared to the bit outside that we use.
The government has tried. They put all that we really need in place.
The Osiomo power plant also supplies electricity to a number of businesses, homes, and communities.
We're supplying power to the secretariat, we're supplying power to the stadium, we're supplying power to the government house, and critically we're supplying power for the street lights. So what it has meant is that government spending on power is significantly reduced. With our second power plant, we are supplying power to Ologbo now, 24/7. That's the first time the community has had power in over 6 years.
These customers of the Independent Power Project say is a huge improvement from what they had before 2022, when the Independent Power Project came on board.
The type of business that we are doing, it requires constant lights. Compared to how BEDC is operating now, I think this Oshomo light is more reliable.
The Oshomo tariff is more higher than that of the BEDC. But when you talk about the availability of the electricity, you can be sure of like 2 weeks, 3 weeks uninterrupted power supply here in Edo Production Center.
There are, however, some challenges being experienced by entrepreneurs at one of the 7 industrial parks approved by President Muhammadu Buhari and the operators of the Independent Power Project.
Once in a month, they will tell you they want to do maintenance, or they will tell you they are short of gas from their head office. They might shut us down for 3 days or thereabout, which will be a challenge to some of us who has perishable goods.
Sometimes there might be trip off and sometimes shortage of gas. But it usually don't really happen always like that, once in a while.
The principal challenge we're having right now is the issue of the gas supply problems that we had recently and all of that.
Have they been able to surmount these challenges?
Sometimes when you complain to the management of the facility, they will tell you then they don't even have enough information.
We normally have light here 24/7, but we just have to have a kind of a backup, which is our generator. So maybe if there's no lights, sometimes 2 days.
But what we've done is we've tried to speak to the government. It has been a very big challenge. And you see, you do, for someone like me, I do as much as 1.6 every month. And what is my profit? My profit is not even up to a quarter of that with all the staffs I have.
The coming on board of the more independent power project in the electricity sector would surely change the game for businesses operating out of the state.
We look forward to the growth and emergence of more of the industrial parks. After Edo State, we hope that more. We hear there are 7 in all, so we need to get word from the other 6. We are wrapping up the show today. It's been interesting having your company all the way, right from yesterday, where we're talking about the power sector, and today that we focused on health. Yesterday, we had the managing director and CEO of the Niger Delta Power Holding Company come talk with us. And today we've had the pleasure to host Dr. Henry Ewunono, who is the spokesperson of the Health Sector Reforms Coalition. And he shared so much with us. What we're taking away at the end of the day is that we need to believe in who we are, what we're capable of doing and providing, the gains of our great country, Nigeria, and we need to be patriotic all the way, lifting one another as we get ahead, because when we succeed and we help others to succeed, our great country succeeds and we're net champion, not on the continent, but in the world.